Thank you for staying with us on The World Now. Each year, the World Tuberculosis Day is commemorated to raise public awareness about the devastation the fast-spreading disease does to human health and its socio-economic consequences. Now, the World Health Organization wants a government to step up efforts to end the global TB epidemic. This date marks the day in 1882 when Dr. Robert Koch announced that he had discovered the bacterium that causes tuberculosis, and that discovery paved the way for medical diagnosis and the search for cure of the disease. Let's look more into the disease, tuberculosis.
Scientists say tuberculosis is an infectious disease caused by bacteria that most often affects the lungs. It spreads through the air when people with TB cough, sneeze, or spit. Doctors say tuberculosis is preventable and curable when detected early. But it is the world's deadliest infectious disease, which is a leading cause of death of persons living with HIV who contract it. The reason for the deaths is related to antimicrobial resistance. For this reason, the World Health Organization is asking governments to close the funding gaps hindering progress towards the eradication of the disease. The WHO says worldwide, TB claimed 1.25 million lives in 2023, with more than 80% of the deaths recorded occurring in low and middle-income countries. Same year, 11 million people fell ill with the disease. According to the UN agency, at least the sum of $22 billion is needed annually for TB prevention and treatment, but global funding is still significantly below expectation. WHO statistics say 2 out of 5 people with drug-resistant TB received treatment in 2023. The World Health Organization is calling for sustained public awareness initiatives like the ceaseless deployment of radio jingles and adverts in local languages for far-reaching effects, and of course the training of community volunteers known as the Community Advocacy Club to screen and detect tuberculosis symptoms and direct those with it to TB clinics to ensure patients complete their treatment plan, which is very important. So far, the World Health Organization rates India, Indonesia, China, the Philippines, Pakistan, Nigeria, Bangladesh, and the Democratic Republic of Congo as the countries with the highest rate of the spread of tuberculosis. This dates back from 2022. The theme of this year's World TB Day is Yes, we can end TB. Commit, invest, and deliver. Jacqueline Ogo, TVC News.
And here in Nigeria, the First Lady Oluremi Tinubu says the sum of 1 billion naira has been approved for the fight against tuberculosis in the country through the Renewed Hope initiative. Now, this formed part of a message to mark the World Tuberculosis Day at Sauka community in Abuja as a national and global Stop TB champion. Senator Oluremi Tinubu says winning the fight against TB can only be possible when efforts are united and investments are made into proven solutions for the delivery of life-saving interventions to all who need them. Let's look into the death of this disease. I'm being joined by Dr. Olufemi Oyekun. He is a family medicine consultant back in Hebron University, London College Health. Thank you for joining us on The World Now. Talk to us about why you think the TB burden is so high. It's seen that it is a vaccine preventable disease in the first place.
The most important reason why the burden of the disease is still significantly high is one, I think, is due to global commitment in terms of a combative consensus that can drive the disease to an end, and also the this recent cut down of U.S., which have been the main driver of global health funding, recent pulling out of their resources. And I think as per today, the WHO is crying for about $5 billion to even attempt to kickstart the entire process of ensuring that we are on the forefront in combating tuberculosis. So I think funding and new consensus around ensuring that we bring it to an end is the main problem driving that is making sure that we are not making credible success.
And I mean, the funding has become a big issue. Reports say that one Nigerian dies of TB every 7 minutes. And seeing that the World Health Organization has also warned that the abrupt cut in global health funding is now threatening its progress. What does the now and the future look like for Nigeria in this fight against tuberculosis?
I think it's going to be looking inward in terms of what Nigeria can do on its own in terms of ensuring that we provide the needed solution and assistance and focus on where needs are, on where there are genuine needs. And tuberculosis is absolutely one of them. So I think that I know that Nigeria has a lot of burdens, but in terms of allowing its citizens to die from vaccine and medication treatable disease is highly unacceptable. But also there has to be some significant political willingness in order to ensure that, and there also has to be a bit of transparency in order to ensure that even if funding is made available, that it gets to the people, genuine people who are absolutely in need of this medication and intervention and vaccines. So I think that's where the focus should be, because in terms of the overall overall political willingness, in terms of is Nigeria willing to ensure that they focus on where needs are in terms of our political readiness? I'm not too sure about that. I'm not too sure.
Well, in a bit to commemorate the day, well, we've seen the government approve 1 billion naira to support the fight against tuberculosis. But talk to us about the risk factors. Since this is an airborne disease, how fast is a person likely to contract this, considering our population in Nigeria, for example, a place like Lagos?
Yeah, no. One of the is an airborne disease, like you have rightly said, and it can be transmitted from person to person, especially if you come in close contact with people who have it. And you know that the health culture in Nigeria is not very robust. People, in terms of seeking of health support, people don't usually go to doctors as the first resort when they feel ill. I think with regards to Nigeria, sometimes they go to the churches, the pastors, the mosque, and then so some might even go to traditional before. And in doing that, each of those contacts, if you are somebody with active TB, you're already spreading it. And if you spread it that way, one of the drivers of the infection is the poor contact tracing, because if you've spent maybe an hour or two with somebody who have active TB, there is a very large possibility that you may have contacted. And sometimes you might not display the symptoms because what we call the latent phase, which means that people have it maybe because of their immune system, they are not yet displaying the symptoms, but they have the active disease. And those kind of people may not spread it, but if peradventure they fall ill or maybe have any other sickness, and then it can trigger the latent TB that was lying dormant, and they also become infectious. So it has to do with our culture and health-seeking behavior. That's what will help drive the disease down.
Dr. Oyeko, it's an ongoing conversation, but thank you for talking to us today. Family medicine consultant back in and Havering University London College of Health. Thank you for joining us on The World Now.
Yeah, it's been a pleasure talking to you.